Hello, welcome to today's episode of Everything Physical Therapy. I am Dr. Steve Ryland, physical therapist. Today we're going to be talking about vertigo. And if you've never experienced vertigo, or maybe you have, you know it can be a very debilitating condition. And we see quite a few patients that are referred to us or even walking off the street that have had some type of episode of vertigo, and it's no fun. I don't wish it upon anyone, but I do want everyone out there to know that if you do experience vertigo, or what we medically call benign paroxysmal positional vertigo, there is treatment, there is help, and it's something that we can fix and get better pretty quickly. And usually when patients walk out of here after their initial consultation and first treatment, they're significantly better. It's actually one of my favorite diagnoses and conditions to treat because you can evoke change very, very quickly and get the patient feeling better, because it can be quite scary. Usually vertigo is triggered, they don't understand really essentially what causes it. It could be certain things. Sometimes antibiotics can trigger it, certain medications can trigger it. Having a cold or the flu, certain viruses can trigger it down the road, but nobody really knows exactly what the underlying cause of vertigo. Some people have it, it will continue on for years where they'll get it, it'll get better, then they'll have episodes of it again. But I want you all to know physical therapy is a frontline provider that treats BPPV or vertigo. And there's many different variations. I can tell you in taking courses that specifically are designed in helping people with vertigo, which I have done, there are many different variations, and you have to be skilled and you have to know exactly what you're doing, first of all, to correctly diagnose it, and second of all, to treat it properly, because it can vary. There can be different things that you have to do with the patient in order to evoke that change and get them better. But that's neither here nor there. What I'm here to tell you today is, if you ever experience vertigo or BPPV, the first thing you need to do is pick up the phone and call your physical therapist and get in to get treated, because it is not something that you want to deal with, because it can be, like I said, it'll stop you from driving, it'll stop you from walking, it'll stop you from getting out of your chair. It really puts a halt on living your life on a daily basis. So, but there is help out there, and that's what I want you to know is, it can be taken care of pretty quickly. So let's talk about what is BPPV, or benign paroxysmal positional vertigo. So essentially you have 6 tubes in your ear, and of those 6 tubes, the posterior canal is the largest of the 6. And that's usually what happens is you have crystals within your inner ear, and some of those crystals can get dislodged. They'll float around, and usually what will happen is they'll end up in that posterior canal. Now, when they get into that posterior canal, there's little cilia or hairs. So think about, you're watching a video underneath the ocean floor. You see a kelp bed. As the waves come in, the kelp moves. As the waves go out, the kelp moves, and it'll cause this swaying back and forth. That's what happens in that posterior canal, or that inner ear, is as you're rocking back and forth, those crystals will get lodged up against those cilia, those hairs, and it basically will block the transmission of what we call proprioception. Where is your body in relation to space? And things can become very disoriented very quick. You can lose your balance, you could fall, you can, most people have to grab a hold of something. They feel like they're falling. It could be when you roll over in bed or sit up in bed, which usually triggers it. But there's a procedure that we do to test it, and it's called the Dix-Hallpike maneuver. And we can check through the Dix-Hallpike and determine where is the lesion. Is it right side, left side? Is it somewhere near the middle? That's where the trained eyes are trained to kind of see where is it coming from, and then provide a very effective treatment the same day to basically get it to really calm down very fast. Once that Dix-Hallpike is performed and we get a definitive differential diagnosis, from there we do the treatment. And the treatment doesn't take very long. What we do ask you to do on your first day, if you're driving, we ask that you come with somebody who can assist you and can bring you for safety reasons, because really after the treatment we don't want you driving, we don't want you turning your head rapidly to one side or the other. And then it's the instructions afterwards that's most important. We give you things for the next 24 to 48 hours, things to do to make sure that once we get it to where you're comfortable and it's mostly resolved, we want to keep it there. We don't want it to come back. So it's very important, the instructions, and I've seen patients over my course of years where they've had it, they've gone in and treated, they've gotten better, but then it comes back. Well, it's important what you do at home. If you're not doing the things at home that your physical therapist instructs you, it could return pretty quickly within the next 24 hours. So we want to make sure it's not just what we do, but it's what you do at home after that treatment that really makes a huge difference. So anyway, in a nutshell, vertigo, BPPV, pick up the phone, call your physical therapist, get in as soon as possible. A lot of people opt to go to their ENT first. The ENT is going to diagnose you. They're going to send you to physical therapy anyway. As physical therapists, we are trained to determine, is it true BPPV? We're going to check other things to make sure there's other things not happening at the time. If something on our radar doesn't add up, we're going to immediately refer you to your doctor or to your ENT to make sure that it's not something else going on. But physical therapy is a front line of defense for vertigo, vertigo-like symptoms, and BPPV. I hope you got something out of this video. I know there's a lot of you out there that are suffering from BPPV that may have got treated or may have not got treated to the fullest extent. We are really good at treating vertigo. We have a 94% success rate over the course of our time, and we really enjoy treating it just because of the rapid results and the lasting results that we get. So I hope you got something out of this. Please like this video if you got something out of it, share it, and continue to look for more videos coming up soon. Dr. Steve Ryland, have a great day.